in a galaxy far, far away, in the future, but somehow simultaneously in the past, one bacteria rises above them all. Streptococcus mitis. So, a quick little history lesson with dentistry is that the first evidence of dentistry being practiced dates as far back as 7000 BC in the Indus Valley civilization. The earliest form of dentistry involved curing tooth-related disorders with bow drills. Sounds awesome, I know. But wait, there's more. The earliest known dental filling was made of beeswax, and this was done 6,500 years ago in Slovenia. The ancient Sumerians in 5000 BC believed that a toothworm was to blame for decay, and that this was a widespread belief through India, Egypt, Japan, and China. Yes, the evil toothworm is the cause of all of our troubles. So, the Greeks were the first to remove teeth with forceps, and modern dentistry has developed between 1650 and 1800, much in part due to this guy on the left, French surgeon Pierre Fauchard. He is considered to be the father of modern dentistry, making advances in tools, and attributed sugar and acids to tooth decay. So you can pretty much thank him for your nice dental office today. Yes, we have come a long way from bow drills and evil tooth-eating worms. So, Streptococcus mitis are commensal bacteria that colonize hard surfaces in the oral cavity, such as dental hard tissues, as well as mucous membranes, and are part of the oral flora. S. mitis is usually forms short chains in circular patterns. These bacteria are gram-positive and found in the human mouth, throat, nasopharynx. It is not usually pathogenic, but can become so under the right circumstances. This is a picture of Streptococcus mitis under the electron microscope. This is a look at the phylogenetics of Streptococcus. The kingdom is bacteria, Firmicutes. The class is Bacilli. The order is Lactobacillus. The family is Streptococci. The genus is Streptococcus, and the species is Mitis. So, going back to the picture under the electron microscope, S. mitis strains usually carry sparsely distributed long fibrils, and their cell surfaces are often regarded as being soft. They consist of circular chromosomes with about 2 million BP that vary with different strains. Its GC and AC content are 40.4% for GC and 59.1% for AT. And there are a total of 2,222 genes, of which 2,149 are protein-coding genes. So, metabolism. Streptococcus mitis live optimally at temperatures between 30 and 35 degrees Celsius, making them mesophiles. They are facultative anaerobes, which means that they can live with or without oxygen. In the presence of oxygen, they make ATP through aerobic respiration. But without oxygen, they use fermentation. This is just a little picture that I found that I thought was pretty funny, so I figured I would throw it in there, just because. The evil popcorn kernels that get us all. So, Streptococcus mitis can cause severe infections, of which the two most notable are got lost in my notes. So, two infections are endocarditis. This is an infection of the lining of the heart. It occurs from bacteria getting in the bloodstream and traveling to the heart and attaching. If left untreated, it can destroy the valves of the heart. Bacteremia occurs when bacteria enter the bloodstream. This can occur through a wound or surgery. Draining a tooth abscess can lead to this infection. Symptoms include fever of over 101, chills, nausea, shortness of breath, and pain. So, what is the importance of all of this? What are we really getting at here? So, the interaction, why is this important? The interaction with a host is that Streptococcus mitis lives in your mouth, your throat, and your nasopharynx. Streptococcus mutans feed on sugar and starches we eat and are the main cause of tooth decay. However, Streptococcus mitis is not considered pathogenic, but it can turn pathogenic and cause infections under the right circumstances. Patients that have immune compromise are more likely for this to happen. So, one really cool fact about Streptococcus mitis is that it actually survived on the moon for 2.5 years. During the Apollo 12 mission, a camera for the Surveyor 3 probe was brought back from the moon, and NASA found that Streptococcus mitis was alive on the camera. This is thought to be from the camera not being properly sanitized before launch 2.5 years earlier. How did this happen? How can this survive in space? I have absolutely no clue. Maybe aliens have something to do with it. I don't know. But that's all I could come up with, so that's all.